Student, in this we are going to discuss about the drugs which are used for the treatment of urinary tract infections and sexually transmitted diseases. Urinary tract infection and sexually transmitted diseases. Okay. So urinary tract infections. Okay, so what is meant by urinary tract infections? Like any infections. So generally, urinary tract is going to be affected by so many microorganisms. Okay, it's called as a urinary tract infections. Okay, any infections, bacterial infections, viral any infection to um, to the uh, any part of the urinary tract, okay, comes from urethra, when go to upper urinary bladder, okay, ureters, okay, kidney, okay. So these are called as a urinary tract infections. Okay, so infection, any infection to the any part of the urinary system is called as a urinary tract infections. Example, okay, so this urinary tract infection classified into upper urinary tract infections and lower urinary tract infections. Lower urinary tract infections, uh, nothing but infection to the bladder, urinary bladder, urethra and prostate is called as a lower urinary tract infections. Like infection to the urinary bladder called cystis, okay, urethra is called as urethritis and prostate is called as a prostatitis. Prostatitis you may see in the males. Okay, next upper urinary tract infections like ureters and kidney, this is called as the pyelonephritis. Okay, pyelonephritis. Okay, so which one is more dangerous? Okay, upper urinary tract is very more dangerous than the lower urinary tract infections. Okay, so next, these urinary tract infections are more in females rather than the males. Okay, so this is the classifications. Okay, so most common cause of infections, respiratory tract infections. Okay, generally what are the factors which predisposed to the urinary tract infection? What are the factors which encourage the development of urinary tract infection? Such as, okay, there is any obstruction in the urine flow, okay, due to blocking of that path, okay, with any stones, kidney stones, maybe in the urinary bladder, maybe in the ureters, okay, maybe in the renal tubules. Okay, so chronic obstruction, so it causes accumulation of urine which causes, okay, infections. Okay, obstruction of flow of urine. Okay, second one is there is a enlargement of the prostate gland. Okay, there is enlargement of the prostate gland is mostly common in elderly people, so where there is a passage of urethra is going to be blocked, okay, because of enlargement of the prostate gland, okay, especially in the men, which causes partially occlusion of the urethra, which generally make the ureters, okay, urethra passes in the penis, urethra passes is going to be blocked, so retention of urine, so it causes infections. Next is um, so catheters, okay, catheters which is uh, placed in the urethra and bladder. Next, without any drinking enough fluids. Okay, next, waiting too long to urinate. Okay, next is a large uterus in pregnant. Okay, next there is a poor toilet habits. Okay, next there is a decrease in the immune system because of the any drug treatment, already I told you. Okay, immunosuppressive drug, okay, maybe cancer chemotherapy, okay, so maybe diabetes mellitus. Okay, so there is a some factors which causes immunity effect. In such cases there is a development of UT is more. Okay, so most of the time, okay, this urinary tract infection mainly caused by bacteria. Okay, mainly most of the urinary tract infection caused by bacteria with in that gram negative bacterial infection is more. Okay, gram negative bacteria, example E. coli, 80% of it comes from E. coli, proteus, klebsiella, pseudomonas. Okay, Next is gram positive bacteria as well as staphylococcus species. Okay. Next, chlamydia trachomatis. Okay, chlamydia trachomatis generally is in females. Mycoplasma, Neisseria gonorrhea. Okay, so these are the other drugs which cause other other than the bacteria they cause, okay, these infections. Okay, so these are the cause agent for the urinary tract infections. Okay. Generally symptoms, general symptoms you can write like fever is came, fever, okay, fever, general fever, chills, body pain. Okay, there is a burning sensation while passing urethra, while passing, okay, in the urethra, burning sensation. There is a there is a feeling of urinations, maturation, difficulty in maturation, fever, chills. Okay, these are all the common symptoms. Okay, there is a okay. So these are the some complications, some problems. Okay, so next is this is about the sign and symptoms of urinary tract infections. So next is there is a treatment. Okay, generally what is the cause? The only cause is one is bacteria, so that you can use antibacterial drugs. Okay, so what are the drugs which are used for the treatment of urinary tract infections? Like antibiotics. Okay, especially there is a sulfonamides, okay, and folic acid antagonists like cotrimoxazole. Okay, next is nitrofurantoin, tetracyclines like doxycycline, ammonoglycosides, acid, gentamicin, beta-lactam antibiotics. Okay, extended spectrum penicillin like piperacillin, third generation cephalosporins, fluoroquinolone, ciprofloxacin. These are the drugs. So these drugs, mechanism of action, side effects already we discussed in the previous chapters. So please keep in mind these are the drugs which are used for the treatment of tract infections. In examination they ask about the drugs which are chemotherapy of urinary tract infections. You can write list out these drugs according to the category of sulfonamides, so and so. Okay, beta lactam antibiotics, so and so, cephalosporin, so and so, fluoroquinolone, so and so, tetracycline, so and so, ammonoglycosides, so and so. You can write these drugs. Okay, classification. After that you can explain whatever you know in detail. Okay, right? So with mechanism of actions, side effects, so and all. Okay, so this is okay. With this I will conclude. Mm. So nitrofurantoin, just you may see in that nitrofurantoin, again it is acting on E. coli, staphylococcus, uh, saprophytics, but other common urinary tract bacteria may be resistant. Gram positive bacteria are susceptible. So nowadays there is a resistant to the nitrofurantoin. So nitrofurantoin is mostly effective for E. coli and staphylosaprophytic bacteria. Okay, so affected. So mechanism of action, generally it may sensitive bacteria reduce the drug to active agent that inhibit various enzymes and damage the DNA. So mainly it inhibit the DNA structure. Okay, sensitive bacteria reduce the nitrofuran into active form. That active form of nitrofuran which damage the DNA. Okay, so pharmacokinetics, it is given by oral route. Okay, so metabolism in the liver, so concentrate in the urine, 25% of the dose excretion unchanged in the, so that okay, it will enter into the urinary tract, so that it is useful for the tract infections. Okay, so urinary pH is kept at acidic to enhance the drug activity. So acidic, in acidic pH the active nitrophilus is more. Okay, so it turns urine to dark orange brown. Generally it is because of its color. Adverse effects, major adverse effects, GA side effects, bleeding to of the stomach, nausea, vomiting, diarrhea. So it is because of G irritation. Because of G irritation, generally cause nausea, vomiting, diarrhea, and bleeding sometimes. So that you can avoid with by taking with food. So pulmonary fibrosis is a major danger one. Okay, headache. Okay, nystagmus. Okay, so contraindications. It is contraindicated in the patient who are suffering from glucose 6 for dehydration because it causes hemolytic anemia in pregnant. Okay, so there is a chances of teratogenic effects. Okay, nitrofuran, it is used as a urinary antiseptic. So in examination sometimes they ask like write a short note on urinary antiseptic. You can write nitrofurantoin. Okay, so don't worry about. Okay, right? So maybe in our exam they ask about write short note on urinary antiseptic. You can write this nitrofurantoin. Okay, So it is used as an antiseptic and has little and no systemic antibacterial activity. Okay, it is only helpful for uncomplicated lower urinary tract infections. Okay, it's majorly useful for uncomplicated, especially lower urinary tract infection, because it is the antibacterial activity is very less. Okay, efficacy is less. Okay, the remaining drugs already you mentioned. Okay, so next is sexual transmitted diseases. Okay, sexual transmitted diseases you can write gonorrhea, syphilis. Okay, um, you can write gonorrhea, syphilis, and trichomonas vaginalis. So these are the sexual transmitted diseases, even AIDS also. Okay, so you can write common organism, and generally these penicillins and cephalosporin generally used and tetracyclines are used for the treatment of this gonorrhea and all. Okay, please refer the textbook, other any that you can write the what is gonorrhea, what are the signs and symptoms, already we discussed in pathophysiology. Syphilis, right? So trichomonas vaginalis. Okay, what is the cause to agent and how the symptoms will be there. Then drugs majority, so these are major drugs, this one only. Okay, fluoroquinolines, penicillins, cephalosporins, and tetracyclines. Okay, just you mention it already, you know the mechanism of actions. So one more thing is prostatitis, acute prostatitis and chronic prostatitis. What is meant prostatitis? It is one of the urinary tract infection, inflammation of the prostate gland associated with infections. Okay, so it is acute and chronic. Acute is mainly non-catheter induced prostatitis and catheter. Okay, non-catheter usually due to E. coli and Klebsiella infections. Okay, drugs. What are the drugs? TMP, cephalosporins, ciprofloxacin, okay, cotrimoxazole. So these are the drugs. Sulfonamides, cotrimoxazole, okay, cephalosporins, cephalosporins, ciprofloxacin are the drug. Okay, as catheter associated. Okay, catheter means any catheter will be inserted into the urethra, that also causes inflammation, especially due to gram negative and enterococci. The antibiotics are ciprofloxacin and ceftriaxone. Chronic maybe due to E. coli, Klebsiella, and protease. So antibiotics are fluoroquinolines. So with this, okay, we completed sexually transmitted infection and urinary tract infections.